Hello, everyone. So here is your introduction. Actually, I should stop my share. Hi, everyone. I am Dr. Lappin. I see a lot of familiar names in the list, the roster for this class. So that is exciting. My hope is that you had a better than crappy experience with me in your first experience with me. For those of you who are not familiar, welcome. This course is a course that I created a couple years ago as an elective to be taught in the summer. And I was asked to adapt this into a 15-week model so that it could be used during the fall and spring semesters. So this is a field that I am very excited about. I want to be transparent in my excitement for this field. And also I'm equipping you with being having critical thinking skills around it, um, which my hope is that I set the stage for that in the very first lecture that I've done for you. Um, okay, so let me just like back up. I'm getting a little bit ahead of myself. So hello, I am Dr. Sarah Lappin. I answer to Dr. Lappin. I answer to Sarah, however you would like to address me. I am going to be holding office hours this semester. So if you need any support from me, if you have any questions of me, the office hours that I'm holding are from 10 until, I'm sorry, yeah, 10 to noon um on Fridays, so Pacific time. So if you cannot make those hours, please just reach out to me and ask me for a one-on-one meeting. I am I pride myself in being very responsive. I know that online you can feel a little bit disconnected. I generally respond to you within a few hours, if not less time than that. Um, but just like wanting to set the stage there, I posted an announcement in Canvas where if you saw the announcement, this is how you found this video, where I have all of the reading materials and PowerPoints for this class in Google Drive. So you do not need to purchase or go anywhere for the articles. Sometimes I know that like links can be broken or inaccurate in Canvas, so I have everything in one place in Google Drive. I upload my videos as you are seeing right now to YouTube. I like doing that because it just feels organized and it generates closed captioning for you. So yeah. Okay, so my background. Again, I'm Dr. Lappin. I'm Sarah. I am a core faculty here at Alliant. I currently work and have transitioned into the online program. But for the last 4 years, I was a core faculty in LA at the Los Angeles campus. Um, I recently moved back to Michigan, my home state. My husband and I have expanded our family. We wanted to be closer to our families of origin, and both of our families of origin are here. So that is why I've transitioned into the online learning world. But prior to being at Alliant, I did my postdoctoral fellowship at the University of Alabama at Birmingham within the School of Public Health, and in the Department of Health Behavior, working as primarily a co-therapist on a study, a randomized controlled trial testing the efficacy of psilocybin assisted psychotherapy for cocaine use disorder. So I spent a little over 4 years doing that, learning from my mentor, Dr. Peter Hendricks, um, who is a clinical psychologist, has a different approach to therapy. But ultimately, what we did was we used a protocol, and you'll read about, like, you'll learn about this throughout the semester. Unfortunately, well, maybe throughout the semester, our publication or our manuscript will be published. But as of right now, we don't have any like public data out, because our study took a really long time. So we actually recruited participants. We needed to get an N of 40. We needed to get 40 participants. 20 of them were dosed with psilocybin, 20 of them were dosed with diphenhydramine, which is basically just Benadryl. So it was a randomized controlled trial, essentially testing the difference in outcomes between psilocybin and a placebo, what we'd consider an active placebo. And we recruited our first participant in June of 2015, and they just wrapped up like gathering data because the participant was in the study actively, I guess, in the intervention for 10 weeks. And then there was a 90-day follow-up and 180-day follow-up. So the participants were in the study for roughly 9 months. So to recruit and then enroll and run each of our 40 participants through the study, it took essentially like 10 years. So that's just something I'm just contextualizing kind of my background in this. So I was with the study for about the first 23 participants. And then I moved on to my teaching role at Alliant. Yeah, we just submitted our manuscript to the Journal of the American Medical Association, JAMA, hoping that it will be published later this year. So again, if it comes out, if it's published during the semester, I doubt it because publication just takes a long time. I will happily refer you to that because it's just more evidence or just like more information about psilocybin assisted psychotherapy in particular. Um, but yeah, I served as a co-therapist on that for about 4 years, um, and saw incredible experiences. So we'll talk about this in later in the semester, but psilocybin assisted therapy is a very internal experience. So ultimately, like when the participants we call them participants because they're part of a clinical trial, but generally they would be called like clients, depending if they were in hospitals, they may be called patients. That's not happening because psilocybin and MDMA are not legal. They don't have FDA approval. Um, the only substance that we'll be talking about this semester that has any sort of legal status or FDA approval is ketamine, and it's actually S-ketamine. But it's when it's used in for like mental health purposes, it's considered to be used off label, but I will define that stuff for you throughout the semester. But off label basically just means like not for the like approved purposes, or like different from the approved purposes. So S-ketamine, for example, is an inhalant. You suck it up your nose or sniff it up your nose. Some ketamine is many times taken orally. So anyway, like we're just all over the place when it comes to these various assisted therapies. So ketamine assisted therapy, MDMA assisted therapy, psilocybin assisted therapy. But I put them in some ways under the umbrella of like the psychedelic assisted psychotherapy movement, even though the only psychedelic that we're actually talking about this semester is psilocybin. MDMA is considered an empathogen. It is not a psychedelic. And ketamine is oh gosh, I always forget. It's like an anesthetic, a dissociative anesthetic. I think that's the class that it's in. Um, so I'm just chatting over here with you. Okay. So that's a little bit about me, a little bit about my history. But what I would like to do is share with you the syllabus, and I will just walk you through kind of what to expect this semester. So like I said here, sorry, my office hours are 10 to 1 or noon. I'll just save that here. You have all this information in Canvas. You have my link. I think there may be a passcode. I never know if I need to have it. But what I want you to do when you're engaging with this syllabus is like read through the rationale and read through the course description, read through the purpose of the course. I think it gives you a really good kind of primer for what we'll be talking about and what I'll be covering this semester. Um, okay, so all of the kind of standard things that you're used to with online learning, please engage, please do the readings. I will say that for this course, it is perhaps, I don't know, maybe y'all have different perspectives on this, but I would consider this more of like a reading heavy class rather than like a productive or like a product heavy class. So our textbook that we'll be using, again, this is in the Google Drive for you, is the Handbook of Medical Hallucinogens. And then we have lots of scientific articles that we'll be reading this semester. You can see, I mean, it's essentially like two full pages of articles that I have for you, all hopefully appropriately. Well, nope, this one's not in APA. This too many capitalized letters. But anyway, um, okay, so these are the assignments that um you will be asked to complete. So you will have, I believe, every single week has a discussion. I tried to be thoughtful and creative in the prompts that I gave you to engage with one another. So remember, you have to have your initial, like to get full credit for this, you have your initial um, post answering the question, and then you need to respond to three substantively, and there's like a rubric for this, to three of your colleagues. We will be doing a self of the therapist reflection. I like to emphasize this in all of my courses. I have a bunch of questions for you to kind of choose from to answer, just about initial thoughts on psychedelic therapy and like psychedelic substances, on hallucinogens. And then I have a few ultimately just like kind of like journal entries for you with implementing psychedelic assisted therapy, risk reflection, and then the medicalization and corporatization. The one thing that I am asking you to hear me right now, that so I again I've taught this class one other time to three different sections. So I had 90 students a couple of summers ago enrolled in various sections of this class. And this therapist interview proved to be quite difficult for them. And primarily, I believe it was from lack of preparation. So, this is due, you'll see here, your interview is due in week 12. I have provided you with a list of really individuals who provide like ketamine integration or ketamine preparation, because again, that's the only legal and FDA approved for specific uses substance that we'll be talking about. You might reach out to people who are doing like clinical trials, maybe with psilocybin or MDMA, or who may be like integration therapists underground for various substances like peyote, ayahuasca, ibogaine, things like that. But I say this because this feels like a long ways away, that you're like, oh, week 12, like I'm not even gonna think about it yet. I do encourage you to take a look at the list that I've provided you. I think part of the, um, let me see. Sorry, y'all. You're just gonna see me quickly scroll through this. Um, Also, if you ever see any errors in the syllabus, let me know. I tried to be really meticulous. Like I said, I created this entire syllabus with a little support from online learning, but it's really all me and my organization. So if anything's like missing or not clear, please let me know. Um, but I think it's week 7 that you're asked to, yeah, preparation. So don't overlook this. So week 7 is when you're like prompted to start to look up therapists. So I've created, or I haven't created, I've like curated for you this psychedelic integration list. Um let's see. Oh, okay. Well, that's good that I know this. I will get this fixed. Um, but there is a list, crap, of practitioners that you can reach out to. I'll find this, I'll fix it before we get to this point. But one thing that happened with my students in a couple summers ago is like everyone started because they're listed alphabetically, so that like everyone started at the top. So that like first clinician got like inundated with requests for an interview, and some students got like really mean responses back. So this list it's got like a couple hundred people on it. Like mix up where you're where you're starting in the list. Um, but do this ahead of time. Many of the clinicians asked for money, like a reimbursement to do this. Many people said they didn't have time. So I think where some students thought, like, I'm going to reach out to like two or three, maybe five people, and one of them will say yes, they ended up having to reach out to like 20, 30, 40 people. So just be, I'm giving you the caution and preparation right now. Start this early. Start this early. I had several students ask for extensions because they waited until like, the Monday of week 12. And were like, oh, I thought I'd be, or, they've scheduled an interview, but they couldn't get it scheduled for a couple weeks after it was due. So like, just please don't put yourself or me in that position. Start this early. It is queued for you in week 7. But I would honestly encourage you to do this even earlier than that. Just like take a look at this list that I'm going to fix. What I'll likely do is post this as a announcement in the class of like an updated list, or like finding where this is. Um, but yeah, actually I'm gonna copy this right now and look for it after I make this video. Um, but yeah, so like I said, I this is more of a reading heavy class. What I'm trying to do for this course is equip you with the most up-to-date information on this. So if you look at the list of like manuscripts and stuff, or articles, like nearly none of them are published like more than 5 years ago, and that's because this is a very quickly moving field, and I just want to give you like the most up to date information. And I do in many ways want this class to kind of follow a psychedelic experience where it is more about like kind of you and your learning. So I really want you to lean into these reflections, really be, critical and use those critical thinking skills, be constructive in this. Be open. Maybe some of you are coming in really like questioning psychedelics and wondering like, how are you, for example, um, treating a substance use disorder with another substance? Like, how is that even possible? That sounds like crazy. Some of you may have a history of using recreationally, and maybe you've had a poor experience with it. Maybe you've had awesome experiences with it. I encourage you to just like be open to learning the material. This is very different from recreational use. It's very structured. The like current Western kind of medicalized approach to this is very structured. And I believe that us as clinicians are extremely important to this process. I think that maybe psychiatrists or individuals who don't really, or medical doctors who don't really focus on the like patient clinician alliance or that therapeutic relationship, they may see that the compound itself, the substance itself, is sufficient. From my experience in this field and just like my personal beliefs around psychotherapy, I believe that our role is key, and I believe that these are inherently relational substances that we're using. And I'm also informed by the indigenous origins of these substances. where community and larger ecology is inseparable from the substance. Like the substance is almost just like a portal to emphasize the relationality. But again, I kind of digress. So hopefully, my hope for you is that you're positioning yourself coming into this class like really interested in learning, putting on your research cap, putting on your critical thinking cap, and you're willing to engage with me and others in holding potentially like very different perspectives on this, and that you're able to respectfully engage with one another. Um, but yeah, I think that's all I have for you for this intro. Again, if you have any questions, please don't hesitate to reach out to me. You can post in Canvas and like some of the general discussion boards. I'll see that. Feel free to reach out to me directly through my email. It's just sarah.lappin@alliant.edu, sara.lappan@alliant.edu. And I look forward to working with all of you this semester.